I'm going to pass this off to Diana, who's going to talk about the Tresse Rx, which is what we call our prescription for home treatment. We've been working with the LOCKx people for a while now. It's something that we actually started looking at long before the coronavirus hit and long before we had to close the office. So it's something we've investigated for many, many months, and I think it's something that would be a great additive to our patients who are already doing treatment while we're home and not able to come in. It can be an adjunct to the treatments you're already using. And for our newer clients, it's one of several treatment plans that we do recommend depending on your type of hair loss. So I'm going to hand this over to Diana at this time. Thank you.
Hi, everybody. Thanks for joining us today. I'm really excited to talk about Tresse Rx. For anybody that is on the webinar that is a current client, obviously some of these things are going to look familiar to you. Like Dr. Wendell said, we've been using laser, specifically the laser cap model, because it is the best model out there right now, for a long time. We've also been using Formula 82M for a long time, which is a topical treatment that gets applied once a day. So we're still recommending those things, and both of those can be done at home. We developed this, so basically we developed this protocol by evaluating the new research and treatments that are available. We're constantly looking at new things. We've been looking at this since January, specifically the at-home microneedling, the Factor 3X serum, which was something that really caught our eye in the beginning, because microneedling is something that we do in the office with our PRP and OPC treatments. And so a lot of people ask about microneedling. And so it's something that we wanted to be able to allow people to do at home. So I'll get into that a little bit more in a little bit. The other reason that we really wanted to push this out right now is because people are at home, people can't come into the office. We just had to reschedule 200 PRP and OPC treatments. And so a lot of those people are just hanging out and waiting till we can open back up and get their treatments back underway. So the at-home treatments are things that people can actually do to bridge the gap and even further enhance the treatments that they're doing. These things are recommended for people whether they're doing PRP or OPC or not. You know, they're things that are going to add on to those treatments, and for people that, you know, financially can't do those treatments or physically can't come into the office right now or even in the future, it's a nice thing to be able to do at home to enhance those results. So basically what makes the Tresse Rx protocol effective, female hair loss, as many of you already know, can be very complex. It's not always one thing that's causing it. And so this is just giving us a multi-therapy approach to target the hair loss from different angles. It gives you the best chance at regrowing hair, decreasing shedding, and overall just rejuvenating the hair and making it as healthy as it can be. And then these treatments are all going to work together. So, you know, with each treatment, you're going to get some benefit, but by adding them all together, you're getting more benefit. You're addressing the health of the follicle, you're addressing the health of the scalp, you're addressing the dietary deficiencies, you're addressing the gut health. So they're all working together. So we kind of started to do this already, but basically breaking down the protocol, the Flex 300 laser cap is going to be, you know, number one. That's something that we have always recommended as a treatment with PRP or OPC or as standalone. We see very good results with that. It has to be done for 30 minutes every other day. The Minoxidil topical treatment, which would be the Formula 82M or Formula 82F, both are topical and compounded from a pharmacy that we use. The microneedle stamp and growth factor 3X serum from LOCKx. So this is new. This is, I'll show you this in a little bit. It's got a, actually I can show it to you now. So basically this has a little chamber. You would fill this with liquid that comes in this box. You get 4 of them. And so you'll see one's missing. I've actually already used one because I wanted to test it out. And so you basically take this liquid out, you open it up, you undo this here, you pour it in, and then there's little teeny tiny needles on here, and you basically just stamp them. So you're breaking the skin with all these teeny tiny needles, but at the same time, you're getting this serum injected into the scalp. So this is something that is really great to do at home once a week while you're at home. And then after doing treatments, we would recommend continuing that once a month. Defense gut health powder from LOCKx. So this is the first step to their supplement line. It comes in a container like this, and it's basically just a powder that gets mixed in with a drink. I actually have been doing this for the last couple of days. You can see I haven't started drinking it yet, but this is what it looks like. And so that's something that's basically going to prime your GI tract and make it work, really help it to promote the other supplements working to their ability. The other thing that I should mention too is that you guys can submit questions. We are going to answer questions at the end. So as we're going through, if you think of anything, you can go ahead and submit the questions. We won't address them till the end, but at least you won't lose your train of thought. So we have the gut health powder, we have the block hair loss supplement, and the guard hair loss supplement. So I'll break those down a little bit further. It's two supplements that ideally should be used together, but can be used separately in some situations. So the laser cap, I really touched on this already. Clinically researched, used for 30 minutes every other day. We choose to work with laser cap because their devices are have the highest energy dose per treatment. They have the highest peak intensity. They have more consistent output, and they're a really good quality device that does last for a long time. They're also warranted for life, and they have a 1-year money-back guarantee. And LaserCap has chosen only to sell through physicians' practices, which is really nice because, you know, people really need to be evaluated, and that's not something that we're saying don't do for anybody that's on here that has not come in to see us. Right now we are doing Zoom video consults, and you know, ideally we want to be able to look at your scalp, but there is a lot that we can pull out of your story, your medical history. You know, we're still able to look at where the hair loss is happening. So there's a lot that we can do via video consult, but you know, LaserCap doesn't just want people out there buying these. We want to make sure that the type of hair loss that you have is something that can help. And with androgenic alopecia and even telogen effluvium and some of the other types of hair loss too, these can be really helpful, the LaserCap. So the Minoxidil topical treatment, again, touched upon this already. So we work with a compounding pharmacy that compounds this formula. The formula 82M contains Minoxidil, which is the active ingredient found in Rogaine. It contains retinoic acid, which actually makes the Minoxidil absorb better. Fluocinolone, which is a steroid. It's a small percentage, and the reason that that is in there is to counteract any irritation that is common with Minoxidil. And vitamin E, and then some proprietary ingredients to make it non-irritating and keep the base stable. We also have this product available with the addition of finasteride, which is another medication that has been used for hair loss. We typically don't give it to women until they've gone through menopause because of the issue with birth defects that it can cause. So if you've gone through menopause already and you choose to do so, you could have the formula 82F. Now, typically results take about 3 months with that, but sometimes people report results within 6 to 8 weeks. Now, the growth factor, 3X serum and microneedling, again, I showed you what this looks like. This is something that I've really been looking at for a long time. Just because, you know, there are studies out there that talk about microneedling being beneficial, and this is a question that people ask me about a lot. Probably a lot of you have seen the derm rollers or microneedling rollers, and those can be really good for skin, but problematic for hair because when people roll that on the scalp, it starts to break off all the hairs. What makes this great is that you're not rolling this, you're stamping. So in terms of like your part line, you're going to stamp it into the part versus rolling where you would break the hair. So this is a really nice way to be able to allow people to do this at home, but not worry that they're going to be breaking off the hair and counteracting the treatment. So basically the serum that goes in here, it's a protein-rich serum blended with vitamin B and beneficial plant extracts. They are designed to condition the scalp and allow optimal hair growth. So the key ingredients in here are going to be the growth factors, the epidermal growth factor, the fibroblast growth factor, and the keratinocyte growth factor. So these are synthesized into peptides and basically a biotin growth factor complex peptide. So that's really going to help to keep those hairs in the growth phase longer, make the hairs overall healthier, help with that miniaturization. Studies have shown that those growth factors to be very beneficial. Now, the sulfate-free cleanser, this is another step that is specific to this line. It's basically going to prep the scalp for the treatment. So by washing your hair with this beforehand, you're really cleansing the scalp and creating the perfect environment for this to work better. So like you saw before when I showed you the box, I did do this once already this week because I wanted to. I was excited to do it for personal reasons and also so I could talk about it. So I will tell you, I like the shampoo. It's a lot thicker than a regular shampoo, but it doesn't suds as well. And that's because it is sulfate free. So you really want to focus that around the scalp to really break everything up. But if you want a little bit more of a lather, you just mix in a little bit like for the rest of your hair. So this is done before and after treatment. You can't shampoo your hair for 8 hours after you do the treatment. So I basically washed my hair. I did dry it the first time just because I wanted to be able to see how much, like as I was stamping, I wanted to see if the hair was getting wet, how much was coming out, but they recommend that you do it with the hair wet. So basically you just, stamp into the part, a bunch of different times, move over, there's enough in the vial to do the entire scalp, but most women are really going to be focusing kind of in this area here. The needles are small, so it really doesn't hurt. You really have to press. You can just barely feel like it's breaking the skin. And so the fluid does come out slow. So I kind of found myself really kind of going through, checking and finding that there was still a lot of liquid. After so many times of puncturing the skin, you can actually just unscrew this and just pour it on and massage it in. You've already created all those little holes there. And then, I went to bed in the morning, I washed my hair again. So it was 8 hours later. So I used this BioCleanse shampoo again. And then you're just gonna put that away and you'll use it each time you do this, or if you're coming into the office for a PRP or an OPC treatment, you can use it before and after those treatments as well. So the gut health powder, again, this is a prebiotic supplement. It includes mineral-rich blue-green algae, which is basically the spirulina, and proven anti-inflammatory botanicals, curcumin, aloe, licorice, and beta-glucan, which address the gut health in powdered form. So those are anti-inflammatory. So really creating that healthy environment for the other supplements that are yet to come to work better. This is something that, like I said, you mix with your water, you drink it once a day for 2 weeks, and you're going to do that by itself. The defense is done first. That's the first step of the protocol. And then once you've completed that 2 weeks, you're then going to start the block and guard. So you don't need to continue the defense beyond the 2 weeks. You can do it every other day if you want to, but it's really meant as the first step to prime the GI tract in order to allow these other supplements to work to the best of their ability. And so the block and the guard are meant to be taken together. The block is basically a follicle enrichment supplement that's formulated with a proprietary blend of botanicals, adaptogens, marine collagen, and saw palmetto. So these are known to support hair growth and help to block the conversion of testosterone to DHT, which we know is very problematic in androgenic alopecia and leads to shrinking or miniaturization of the hair follicle. And so this particular step of the process is particularly formulated to prevent that and to stimulate hair growth and decrease hair loss. So the key ingredients here are the saw palmetto, which helps with that DHT, the ashwagandha, which is also a stress manager too. Resveratrol helps to fight free radical damage, and then marine collagen as well. And so like I said, the guard and the block are taken together. It's 2 tablets of the block and 2 tablets of the guard. The guard is a premier blend of super vitamin B and biotin in supplement form, and it's in the most bioavailable form, so it's easy for your body to absorb. but vitamin B and biotin are known as ingredients necessary to promote conditions to support healthy hair. The most crucial element of LOCKx, B vitamin complex, is its reduced form, which allows immediate bioavailability, like I said, for rapid assimilation and metabolizing without accumulation in the body. So how ingredients in defense, block, and guard can help with hair health. So you have your biotin and amino acids, which are reported to play a beneficial role in maintaining healthy hair and scalp and controlling dandruff. So you have the amino acids L-lysine and L-cysteine in the block. Guard contains the biotin, and then the defense contains the amino acid L-glutamine. Nicotinamide and nicotinamide pathways involved in B3 production maintains scalp health and increases hair diameter. So the guard contains niacin, which is the B3. Vitamin B6 and B12 are essential for supporting hair structure, and the amino acid lysine is known to reduce hair loss. So the guard contains the B vitamins, the block contains the L-lysine. Inflammation around the hair follicle is known to cause many types of hair loss. So the defense contains large quantity of the well-known anti-inflammatory ingredients turmeric and licorice root. So this is, again, where consultation can be very helpful, because these supplements we're not going to just recommend for people that are having androgenic alopecia or telogen effluvium. This potentially is something that we can use with other types of hair loss, like alopecia areata, like the scarring types of hair loss, because inflammation is something that we see in those types of hair loss, and these supplements can definitely help in those types of hair losses as well. Due to poor diet habits, which are among the many causative environmental factors that lead to the situation of intestinal dysbiosis, a compromised host ability to maintain a balanced gut is a challenge. So that's really where the defense comes in. It was formulated against leaky gut with beta-glucan, L-glutamine, and aloe as the prebiotic and gut mucosal lining balancing ingredients. So prebiotics are basically they're the food for probiotics. So we hear a lot about probiotics. A lot of people are taking those. We have probiotics inside our GI tract already. So for people with sensitive stomachs, this isn't, our hope is that this isn't going to cause more of an issue. We can start out slower for people that do have sensitive stomachs, but we're not adding any new organisms. We're basically feeding the ones that are already in there to create that healthy environment. So who would we recommend Tresse Rx plan to? So again, consultation is important for people that have already had a consultation and people that have not. So for our patients that are interested in this, you can call us. We're available today. We would like to talk to people about this. So we're happy to discuss this for your particular needs. For anybody that has not had a consultation already, we're available. Rosie, myself, Dr. Wendell, we'd be happy to do a Zoom video consultation to try to get a little bit more information, diagnose you over the phone if possible, and then we can kind of guide you to what the best treatment plan is for your specific needs. But essentially, any type of hair loss can use pieces of this plan. For androgenic alopecia, it's the entire plan. For telogen effluvium, it's going to be everything, traction alopecia, and then again, when we get into alopecia areata and scarring alopecia, those are a little bit more patient specific. We want to know what you've tried already, how active it is, things like that, and that's going to help us to determine if these treatments will be helpful. For patients that are already undergoing optimal platelet concentration therapy and platelet-rich plasma therapy, this is a really good option for people that are kind of in that limbo period. We've had people that we are having to restart their series, or we're having to do more treatments because they're outside of the optimal treatment window that we recommend. And so for a lot of those people, if they're not doing anything right now, they're not maximizing the benefits of the treatments that they've already had. So specifically, the microchannel applicator and the growth factor 3X serum is something that would definitely be recommended for those people, but really the entire line. If people are not on a supplement already, they should be. If people are taking a supplement, you know, the block and the guard are comparable to Nutrafol and more cost effective. The defense is just adding that next layer to it. So for people that are, you know, really like the supplements that they're already on, they don't necessarily need to switch. But it would definitely be recommended to add the defense just to make them work better. And so next steps would be to call the office to talk to us about starting these treatments. If you have, if you're a current patient, if you're not, give us a call to schedule a consultation. The laser cap and the 82M are products that can be shipped out. So the laser cap would come directly from our office. The formula 82M or 82F, those would be shipped out directly from Master Farm, which is the pharmacy we work with. And then LOCKx, you know, we've been, it's been kind of a rapid time frame to really get this pushed out. And so right now we're ordering directly from their website. So if you give us a call so that we can chat with you about, you know, which treatments are best for your situation, we will give you a discount code. So you go directly to their website, you will put in the code, you'll order depending on what you decide to order, there is a starter, like a Try Me special, that contains everything. It's got the defense, the block, the guard, the shampoo, the 3X serum and applicator. So that's a 1 month supply of everything. So that's typically recommended, but we may have you add or subtract things depending. So we'll give you that code. You'll go to the website, you'll put it in, you'll get a 10% off. And then we are giving some discounts for people that are going to do the entire Tresse Rx plan with the laser and the 82M. There's going to be some discounts